welcome to our very special feature, Matters of the Heart. Health is top priority for all of us right now. The COVID pandemic has reminded us that our priority lists need a massive reshuffling. Regardless of where we live, regardless of our nature of work, our schedules, region, income groups, on top of our priority list is health, period. What we considered possible earlier is now a pressing issue, and it is important for all of us to acknowledge the importance that investing in matters of health deserves. With cardiovascular diseases becoming the leading cause of mortality in India, it is important to spread awareness about heart health in India. The past 2 decades have seen heart diseases become the leading cause of mortality in the country, with a fourth of all deaths attributable to various cardiovascular diseases. What is alarming is the fact that the condition affects us Indians in our most productive middle years, almost a decade earlier than our European counterparts. 52% of all cardiovascular deaths in India occur before the age of 70. This special show, Matters of the Heart, aims to increase awareness about this pressing issue and wishes that we, the people, are motivated to take good care of our heart. Joining me for today's special is Dr. Ravinder Singh Rao. Dr. Rao is the Chief Interventional Cardiologist, the Chairman, RHL Heart Center, Jaipur, and Head of Complex and Angioplasty and TAVI Program, or the TAVI program. As a leading expert, he will share key insights about the latest innovative treatments for some progressively serious cardiac diseases and give us also the much needed crucial advice for patients as well as the caregivers. Welcome to the show, Dr. Rao. What a pleasure to have you here with us.
Thank you very much. Pleasure's all mine.
So let's begin today's discussion. Dr. Rao, data suggests that cardiovascular diseases, or the CVDs, are the #1 cause of death around the world. The prevalence of heart diseases in India is also on the rise. So hence, could you shed some light on the current state of CVDs in India and the most common diseases?
Ms. Narula, that's a very important question in the present scenario because, we don't want to be global leaders in terms of cardiovascular disease. We want to be global leaders in terms of advancement of science and various other issues. I'm going to share a very interesting data which was published in Lancet, which is a leading medical journal. In 1992, the leading cause of death in our country was tuberculosis. But in 2013, the leading cause of death was cardiovascular disease, means the diseases of the heart and blood vessel. In 2016, 54.5 million patients in our country suffered from cardiovascular diseases. And 1 in 4 deaths, which is happening in our country, is related to cardiovascular disease. So you see, it imposes a heavy economic as well as social burden on our society and in turn affects our country as well. Now, the difference from the Western world is more and more younger patients are being affected from cardiovascular disease in our country compared to the Western world. Here, the heart problem appears a decade or 2 earlier compared to patients in the West. So definitely there are certain factors which needs to be looked into from a doctor's perspective, from the society perspective, as that what are the reasons why there is an increase in the cardiovascular disease. Now, the cardiovascular disease is a broad spectrum which includes the diseases of the heart, diseases of the blood vessels, as well as the blood supply to the brain. Now, there has been a definitive change in the lifestyle which is contributing to this increase in the cardiovascular disease in our country.
Dr. Rao, 1 in 4 deaths are due to cardiovascular diseases. It is indeed an alarming statistic. According to the WHO, CVDs also account for 45% of deaths in the age bracket of 40 to 69 years old people. These statistics definitely are concerning. One of the key barriers, apart from affordability, is to seek good care and treatment is lack of awareness about the heart conditions and the specialist patients need to visit for the checkup. So for the benefit of our viewers, if you could just elaborate on the specialists whom patients could be referred to based on the conditions that are diagnosed by their general physicians.
Again, we need to actually look into the reasons why there is an increase in cardiovascular disease in our country, and also why we are not able to offer treatment to the last patient in our country. So, the majority of patients, they come in contact with their general physicians who see them every day or every week, or maybe they are seeing their family members for some reason or the other. Now, patients who are suffering from ischemic heart disease. Ischemic heart disease refers to the condition where the blood supply to the heart is compromised. These patients, they need treatment given by their basic physician, which includes blood thinners and various other medicines, but they need to be referred to a cardiologist or an intervention cardiologist at the nearest center, so that the important time is not wasted if a patient is suffering from a heart attack. Now, if a patient develops a stroke, which can also be diagnosed by the family physicians as well as the general practitioner, such patients should be referred to the neurologist. But before referral, they need to be given appropriate treatment at the local center, so that the patients can be transferred or referred to a various specialists by giving a proper first aid care. Now, if a patient needs any sort of an emergency open heart surgery, such patients can be referred to a cardiothoracic surgeon. But in a wider spectrum, a general physician can easily diagnose the initial symptoms of serious cardiac problem, and they can refer such patients appropriately after giving them a first aid treatment.
That is very interesting, especially to learn about different specialists and how much a general physician can help with the first point of care. We often hear about silent, understated heart conditions. Could you throw some light on lesser known conditions and their impact on the patients?
So we come across this question from our patients as well as the people in the community, that what is a silent heart attack? Once in a while, there is a news in the newspapers that certain VIP patient has suffered from a massive silent heart attack. Such things we see in our society. I would not say very common, but it happens. Now, what is a silent heart attack? Silent heart attack is a condition wherein patient is absolutely fine. All of a sudden, he would just complain of some discomfort in the chest, some gastritis-like symptoms, and in a very short span of time, even before the patient reaches a hospital or a nearby medical facility, patient is no more. So such situation is seen more in patients who are diabetic, because they don't feel any pain, because pain fibers are not active. And there are certain category of patients who have a very strong family history of cardiac problem. And now there would be another category of patients who would have had a cardiac problem. They have been diagnosed with cardiac disease, but for some reason or another, they are not able to seek treatment on the proper time. So such patients, they suffer from a silent heart attack. But my message to the community is, stay fit, stay healthy, and just be in touch with your general physician or a family physician. So patients who are into high risk category can be screened by certain investigations, by lipid profile, a CT coronary calcium score, and such things can be prevented to a greater extent.
Dr. Rao, we also hear about the heart failure, which I believe is different from a heart attack. One of the key reasons for heart failure is the heart valve related problems. What are the medications to treat such valvular diseases?
So there are four valves in our heart, two on the left side, two on the right side. The left-sided valves is called mitral valve and aortic valve, and on the right side, it's tricuspid valve and the pulmonary valve. So there are per se no medicines which can treat valvular heart disease. But what do medicines do? Until patient develops severe valvular heart disease, which could be either a severe regurgitation, which refers to the leaking valve, so that because in that condition, the blood comes back to the previous chamber, or a stenotic valve, where the orifice of the valve narrows down so that the blood flow which is supposed to flow out of the heart does not flow. Until then, medicines, help the patient to modify the risk factors which can lead to aggressive progression of a disease. So what do I mean by that? We try to control the comorbidities. Like if a patient is hypertensive, we would give them a medicine to control the blood pressure. If patient is diabetic, we would give them medicines to control the diabetes. And there is certain category which is called as rheumatic heart disease, which is seen in younger patients. This category of patients, they take injection every 21 days until the age of 40 years. which is called as secondary prophylaxis, so that the disease does not affect the valves. But per se, there is no medicine which can cure a valvular heart disease.
Dr. Rao, that's a wonderful explanation about part of our hearts that we do not pay much attention to. None of us do, for that matter. Most of us don't. It is safe to say that valves are the swing doors of heart, helping blood flow in the right direction. If these valves are damaged, the blood flow is impacted or compromised. And correct me if I'm wrong. If not medications, what is the alternative for the people who are suffering from severe asymptomatic valvular heart diseases?
You were absolutely right. So the aortic stenosis is one type of disease which affects the aortic valve. Now, as I explained, stenosis refers to the narrowing down of the orifice. In a normal individual's heart, the blood which flows out of the aortic valve is almost 5 liters per minute. And now if that individual is, running or doing activities and physically very active, it can increase to 8 liters, 9 liters, 10 liters per minute. Just imagine the engineering which God has given inside the heart. So in aortic stenosis, the leaflets, they become thickened and they don't open. So as a result, the heart has to work with extra pressure and force to pump the blood out. So there is a long asymptomatic phase. What do I mean by that? The heart compensates for the disease and patients don't feel any symptoms. But at one stage, because of the severity of the disease, the heart starts decompensating. And that is the point where the patients feel shortness of breath on doing their activities. They might feel chest heaviness, and some of them can even feel giddiness or they can pass out. Once the symptoms are severe and the symptom has started to happen, that is the time that we need to replace the valve. The reason is because this is a mechanical problem. The valve is not opening. A mechanical problem needs a mechanical solution, wherein we need to put in the new valve inside the old valve, which can start functioning normally. And this is how it has been shown in the research that once the valve is replaced, the patients lead a normal life as per their lifespan and their age.
Well, thank you so much, Dr. Rao, for opening our eyes to matters of the heart that we were completely unaware of. With that, it's time now for a short commercial break on matters of the heart. Stay tuned. We're going to be right back with Dr. Rao to discuss more. Welcome back to the special feature, Matters of the Heart, where we're discussing crucial subject of heart health with our leading expert, Dr. Ravinder Singh Rao, and I'm Jayati Narula. Before the break, we learned about the current state of cardiovascular diseases in India and the different kinds of CVDs that are plaguing the population today. More importantly, we also learned about the silent, understated heart conditions such as silent heart attacks and heart failures. And if any one of you is experiencing any of these symptoms, worsening chest pains, palpitations, shortness of breath, fainting, fatigue, you should call emergency services immediately. Remember, health is always top priority. So continuing with our discussion now with Dr. Rao. Dr. Rao, mechanical problems do need a mechanical solution, like you have pointed out. Being one of the earliest adopters of innovative valve replacement procedure, TAVR or TAVI, could you share what makes this new technology cutting edge and how do you go about patient selection for this treatment option?
Thank you. So the TAVI or TAVR stands for transcatheter aortic valve replacement, wherein we can replace the aortic valve without opening the chest by going from the femoral vessel. Now, if you look at the latest guideline published by the American Heart Association in December 2020, it says that any individual who is above age of 65 years and suffers from aortic stenosis, if the aortic valve can be replaced by the vessel in the groin, which is called as transfemoral, then TAVI is a class 1 indication treatment. I also published my largest series in the country in the Indian Heart Journal, where I shared my own outcome of 105 patients from a single center and compared the outcome with the latest published data from the Western world. What we showed in our study is that patients who are suffering from severe aortic stenosis, number one, number two, symptomatic, means they need to have symptoms. We were safely able to replace the aortic valve by going from the femoral vessels without any open heart surgery. So any patient who is a candidate for bioprosthetic valve or tissue valve and is above the age of 60 can be considered for a transcatheter aortic valve implantation. The reason I brought it down to 60 in my own experience is, you see, the average age lifespan of a person is around 82 years. But in our country, the average lifespan of a female is 67. The average lifespan of a male is around 72 to 73 years. But we need to select the right patient in whom the procedure can be done safely with equivalent outcomes to an open heart surgery when we are offering this therapy to a younger patient. So in short, a patient who has severe aortic stenosis and has symptoms and is a candidate for a tissue valve can be considered for transcatheter aortic valve implantation or TAVI procedure.
Wow, that's a really sophisticated and game-changing technology, Dr. Rao. Remarkable to see such treatment options in India for people who can avail all of this. What can one expect from TAVR procedure, Dr. Rao?
So again, a very, very important question. So, sometimes patients ask that why one therapy is better than another therapy. The current era is an era of evidence-based medicine. There's nothing like hypothetical or anecdotal cases in medical science. We need to give evidence to the patients that a certain therapy is better than the standard therapy. So there are certain studies which were done comparing TAVI versus open heart surgery in high risk, intermediate risk, and low risk patients as well. I'm not going to go into detail of those names of those studies, but it is all over the internet. And in those studies, it was clearly shown that the TAVI is better than open heart surgery in terms of death, in terms of stroke, in terms of atrial fibrillation, in terms of renal injury. All these complications, they are lesser when the valve is replaced by TAVI procedure compared to open heart surgery. So patients can expect a quicker recovery, a good quality of life, and back to normal lifestyle after 5 to 7 days.
How long is the TAVR procedure and what is the recovery phase like?
So the data which I published in Indian Heart Journal, the entire procedure was done under conscious sedation. There is no general anesthesia given to the patient. So the average procedure time is 45 minutes. And the patient is able to meet the family immediately after the procedure, and they talk with the family members. For them, it's like a magic. The valve has been replaced. There is no cut, no scar, and they can talk to the family members post-procedure. Now, the average ICU stay is just 1 day. After that, the patient is shifted out of the ICU, and for next couple of days, they rehabilitate, walk, do some exercise, do some yoga, learn lifestyle modification lessons, learn about their medicines, optimize the medicines, and they are ready to go home or fly out, whatever the patient wishes. So I'm just going to highlight one more important thing. Currently, there are certain category of patients who do extremely well and they can be shifted out of the ICU just on the same day. They can stay with the family, and in next 2 to 3 days, they are out of the hospital. And after 7 days, they are ready to do their daily activities.
Dr. Rao, how long does a transcatheter heart valve last, and are there any risks associated with this particular procedure? Seems like heart treatments are keeping up with the times and making life safer, easier and longer for patients. With expanded options for replacing stiff or leaky heart valves, more people perhaps can avoid surgery. Understandably, people would prefer TAVR because it does not require general anesthesia and has an easier, shorter recovery.
So that's again a very important question. If a procedure is approved by US FDA, the reason I mentioned that term of US FDA is because there is a very aggressive scrutiny which goes into before a certain procedure is approved for human use or for routine use. Similarly, the same procedure is also followed in India by DCGI, which is Drug Controller General of India, where a serious scrutiny of entire procedure and its outcome and its safety and its efficacy is established, and then only a certain treatment is offered to our patients. Now, answering to your question on the longevity, that's a very important question. The TAVI valve is a tissue valve. Now, we have head-to-head comparison of a TAVI tissue valve with a surgical tissue valve, and the data is out up till 8 years. It clearly shows that the TAVI valve lasts longer than the surgical valve, and the gradients and the effective orifice area of the TAVI valve is better than the surgical valve. So I'm going to mention the name of the study as well. It is called as Notion 8-year outcome, which showed that 23%, 23 to 24% of the surgical valve deteriorated compared to only 7 to 8% of the TAVI valve.
We don't know what course the pandemic is going to take in the future, but what we do know is that taking care of our hearts right now is more important than ever before. Listen to your heart, quite literally, and make better lifestyle choices. Seeking timely care is a must, and do not delay if you're experiencing symptoms or discomfort, as Dr. Rao was mentioning. We don't want to be a leader in more CVD cases and deaths. Rather, we want to see India lead in declining trends with CVDs. Remember, a healthy heart lies at the center of overall well-being of an individual. With that, it's a wrap on this special feature from me, Chaiti Narula, and of course, thank you very much, Dr. Rao, once again.
Thank you very much. Take care of your heart, take care of your family, and take care of the country. Thank you so much. Stay healthy.
Thank you all viewers for watching, for tuning in. That's a wrap.